ഇന്നത്തെ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റിൽ നമ്മുടെ കൂടെ ജോയിൻ ചെയ്യുന്ന ഡോക്ടർ പരിയാണ്, സ്പെഷ്യലിസ്റ്റ് ജനറൽ സർജൻ ആണ്. നമ്മൾ സംസാരിക്കുന്ന ബ്രസ്റ്റ് ക്യാൻസർ എന്നുള്ള വിഷയത്തിനെ കുറിച്ചാണ്. Doctor, good afternoon and welcome to the show.
Good afternoon.
Doctor, this is something, breast cancer is something we are talking very widely, especially in October. The month is called the Pinktober and all. What is actually this breast cancer?
See, breast cancer is a leading cause of cancer death in all the women all over the world. It is like in 2018 till September, like first 9 months, more than 2.09 million ladies are already diagnosed with breast cancer. It is said 1 in 8 women have risk of developing breast cancer in their lifetime. So it is very, very high and it is growing very fast. Males, although less frequently affected by breast cancer, still 1% of males are affected by breast cancer.
Okay, that is something new information, because we always think that breast cancer is associated with ladies.
Yes.
But then how can we define this breast cancer?
The cancer is normally cells divide in a controlled way. When they divide in an uncontrolled way or divide very fast, then it gives rise to a swelling or a lump. And then we can differentiate it into a cancer.
Okay. So when a lump is there, how can we know that it can be cancerous or how it will lead to a cancer?
See, when the lump is found, first we will see the types of the breast cancer. Usually, I would like to say that breast is made up of lobules, that is milk secreting glands, and the duct or the tubes which take the milk from the lobule to the nipple, and it is embedded into fat and the fibrous tissue. Now, the types of breast cancers are usually which develop in the lobule or in the duct, or other types of breast cancer which are rare. So the main breast cancer which is seen is duct cancer. So the cancer which develops within the duct does not go out. It's called as in situ carcinoma. So many times the patients come to ask that it is in situ means what? That it is within the given surrounding tissue. And invasive breast cancer means which is spread outside the tissue which is containing it. So basically these are the two types, that in situ carcinoma, invasive carcinoma, seen mainly in ducts.
And when you talk about breastfeeding, is there anything associated with that? If we breastfeed the child, that risk of cancer is less, or otherwise it is more risk? Is there anything like that?
Yes, I would like to say the causes of breast cancer. The exact cause is not known. But we can say the risk factor of developing breast cancer. For the understanding of viewers, I will divide it into a uncontrollable risk factor and controllable risk factor. As the name suggests, uncontrollable means not in our hand. So as I will first tell about uncontrollable risk factor, these factors like females, like I told you, women are more affected than males. Second is, as the age goes on increasing, the female are more tend to develop into a breast cancer. Third is mutation of breast cancer genes like BRCA1 and BRCA2. Nowadays we are more getting involved into this genetics. So it is mutation of these genes which give rise to the breast cancer. Fourth is the previous history of breast cancer in another breast. So that lady has the chance of developing the breast cancer in the other breast 2 to 4%. Or cancer breast in cancer in ovaries. Those ladies are having more high risk of developing into a breast. The fifth is early menstruation period before the age of 12, or menopause, which like stopping of menses after the age of 55. The more is the period of estrogen in the body, the more are the chances of risk of developing breast cancer. So these were the uncontrollable risk factor. Now we'll go to controllable risk factor again for the understanding. First is early pregnancy and early having baby before the age of 30. First child before age of 30 is a preventive for having breast cancer. Second, the question which you asked me, that breastfeeding, yes, breastfeeding is preventive for breast cancer. So we suggest around 1.5 years to 2 years breastfeeding for every baby. Third is controllable factor, obesity. So eating healthy diet. So anybody who is eating more fatty food, high in saturated and hydrogenated fat, have more risk of developing a breast cancer. Fourth is again inactivity, lack of exercise. having more alcoholic drinks or having more smoking, taking oral contraceptive pills continuously without knowing a doctor, for 5 years, or taking hormonal replacement therapy after menopause continuously through 3 to 5 years. These are the risk factors, which can be controlled.
And coming to this cosmetics, suddenly the cosmetics are coming to my mind when we talk about breast cancer. We use many kind of deos and perfumes and all. Does that lead?
Very good questions, because nowadays these WhatsApp messages are coming,
Yeah.
and they are saying all those deos and everything.
Yes.
No, it does not affect, because see, now I have told you the causes, exact causes not known, but these are the risk factors. And in those risk factors, these deos are, this doesn't come. No, it is not a risk factor.
Because that is something every time when we open the social media, we'll find these things, some kind of chemicals, or these things are all carcinogenic.
No, they are carcinogenic for the skin. Not for the breast.
Not for the breast.
Yes. So these can be carcinogenic for the skin cancers. But not for the breast cancers.
Having said about the causes, what are the symptoms or the early signs what we can know?
Early signs, like I told you before. So as I told you, in the duct, when the cells are in the duct, those are called as early breast cancer. I would like to come to it later, that is for screening of breast cancer. But the symptoms, what you are talking about, symptoms are seen, like first is the lump or the swelling which is felt in the breast examination, or the lady will feel when she is examining herself. Or it is felt when she goes to a doctor. Second is the change in the size of the swelling of the breast. It can either grow suddenly or it can reduce in size. Even that can be the cause of the symptoms of breast cancer. Third is the change in the color of the breast. A part will go red, or the complete breast can turn red. Fourth is the nipple, which can suddenly retract, which was normal before. But now it is retracted. Or having a nipple discharge, which is other than milk. So it will be blood or greenish discharge. So these are the symptoms of breast cancer. The another symptom which is not usually seen by ladies is the scaling of the areola. Areola is a part around the nipple, which is brown in color. So there can be scaling, or there can be a rash kind of a thing, which is not getting healed, that can be a symptom of breast cancer. So even the lump in the armpit, that is also a symptom of breast cancer. So there are multiple symptoms, and it changes from patient to patient. So I would like to say that patient should be well aware, and there where screening of breast cancer comes.
Of course. Apart from like other cancers, this is something which we can detect very early by self-examining itself. Can you please discuss about that?
See, this is the self-breast examination or screening of breast cancer. We say screening of breast cancer is in the different ways. First is self-breast examination. Second is clinical breast examination. And third is a radiological breast examination. So first I will come to the screening or self-breast examination. Self-breast examination is starting from the age of 20. So I would like to again tell this point that it is so early. Because nowadays, instead of saying that the cancer breast is a disease of old age, it is seen in younger age group or in the middle age. So breast screening starts as early as 20. Every month, the girl, she is supposed to do a proper examination of her own breast. It has to be done every month. If the periods are regular, from the 5th to 7th day of her cycle, every month she can do. If the periods are irregular, she can select one date and she can do it on that day. It is better if she is being taught by a surgeon or by a doctor who knows how to do the self-examination. But that is how it is seen early, detected early, and early detection saves life, Second is the clinical breast examination. Clinical breast examination is done by the surgeon who is trained into examining the breast properly. So it should be done from the age of 20 to 35. Every 2 years or 3 years, if the patient is absolutely fine. Still you should go to a doctor to get your breast examined by the doctor. After age of 35, it should be done every year. After age of 40 to 45, depending on whether symptoms are there or symptoms are not there, So depending on that, it should be done 6 monthly or yearly.
Okay.
It will take around 5 to 10 minutes.
Okay.
Let the doctor decide which is the better way of doing radiological examination. Okay, because there is ultrasound, there is mammogram, there is MRI scan, which is good for that given patient.
Okay.
Okay. So you cannot blindly go, because there are 2 steps. First clinical breast examination, then history, then what are the findings.
Okay.
Then we will decide that, okay, which radiological test is good for this particular patient.
Okay.
So we say ultrasound and mammography, these are the basic tests. Then MRI depends on patient, from patient to patient.
Okay.
But ultrasound scan is done in a dense breast which is younger.
Okay.
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 It differentiates solid and cystic swelling.
Okay.
And mammography is the basic tool of differentiating from normal breast to the abnormal breast or cancer breast. It is seen like, now that cancer again comes back, that in situ carcinoma, which are not palpated even by the doctor, can be detected by mammogram.
Okay. Okay.
Okay, so this mammography is a very, very important radiological investigation. Only it should be done in the breast which is a little less dense.
Okay.
Okay. So as the age increases, the breast becomes less dense.
Okay.
So before that, we cannot do in certain patients the mammography.
Okay.
So usually that's why we say mammography age is above 40. Depending on that patient, doctors will decide that, okay, this patient needs mammography or not.
Okay.
And then in the mammography, if we detect early, that's why we say early detection saves life.
Okay.
We had in our center this Pink October.
Yes, yes.
And we had mammography screening with the surgeons. Everything was free. And mammography was only for 199 dirhams.
Yeah.
And we have now extended the offer till 10th of November.
Okay.
So anybody who wants to take the chance and come again, it is extended till 10th of November.
Okay. And coming to hereditary, does that play a role in this?
Yes, of course. Yes, that I said that about 10 to 5 to 10% only plays role hereditary.
Okay.
Okay. So this BRCA1 and BRCA2, the genes which we were talking about, that mutation of genes happen, and this is how it is examined and found in the patients. So these kind of mutation genes happen in only 5 to 10% of total breast cancers.
Okay. Okay.
Okay. So yes, if there is first degree relative of breast cancer, then there are chances of developing breast cancer is more than the common population. But if we take 100 people who are already having breast cancer, only 5 to 10% of them will be familial.
Okay. Now, when if we come to the diagnosis of breast cancer, how is the diagnosis done?
Already we have seen self breast examination. Yes. If the patient is examining herself, then it is very good.
Okay.
Then we come to clinical breast examination. Clinical breast examination, the doctor examines the breast completely, decides what kind of test is required on the. Some test also might not show the lump which is felt clinically.
Okay, okay.
Okay, so that is also very important. So doctor's examination is very important.
Okay.
So then we will see the examination, the lump, how it is felt. Then we'll decide and do ultrasound or mammography. If there is a lump which is found on the mammogram or ultrasound, which is suspicious.
Okay.
Okay. Then these kind of lumps we need to do tissue diagnosis.
Yeah.
So tissue diagnosis is done either by FNAC, that is fine needle aspiration.
Yeah.
We put a needle,
we
take out the cell and see it on the slide to diagnose. The second is biopsy, tissue biopsy.
Okay.
So it can be a small part of lump is taken out or the complete lump is taken out, depending on how is the patient. And finally we diagnose whether the patient is having breast cancer or not.
Okay. Having said about the diagnosis, definitely we have to move on to the treatment part of it. How is the treatment part of it?
See, treatment depends on what stage of the disease we diagnose the patient.
Okay.
As I said early, early diagnosis saves life. So if it is very early, only small tumor is there in the breast.
Okay.
What we see, whether it is spread to the surrounding tissue, we see whether it is gone to the lymph nodes, that is the underarm, what I was saying, the swelling in the underarms, or it is metastatized, or what we say it is gone through the lymph or through the blood vessels to the surrounding tissue. So it can go to bones, it can go to lung, it can go to liver, it can go to brain. So all these places it can metastasize. So it depends on which stage it is. So it depends on these 4 factors. So first we will see the size, then we will see whether it is in situ or invasive carcinoma. Locally, how big is it? Then underarms, lymph nodes involved or not, and whether it is already metastatized or not.
And then comes the treatment part, like the surgery and all. We are scared to talk about that when we see that breast removal is done and all these things. How is the things about that?
See, it is not the complete breast removal removed every time, you know. It is, again, I said, as it depends on at what stage it is detected. Surgery has really grown, and now it is like for small breast tumors, which are very small, we don't remove the whole breast. So we remove only the part of the breast which is around that particular lump. If it is a little bigger, then we remove that much quadrant of the breast. If it is really big, only then complete breast removal is done. So this is about surgery. There are other ways of treatment. So the first way is radiation, then is the chemotherapy, then is the hormonal therapy, and there is new targeted therapy. So these are the different ways or methods in which different breast cancers are treated.
നമ്മൾ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റിൽ ഇപ്പോൾ സംസാരിച്ചുകൊണ്ടിരിക്കുന്ന ബ്രസ്റ്റ് ക്യാൻസറിനെ കുറിച്ചാണ്. നമുക്ക് കൂടുതൽ പ്രേക്ഷകർക്ക് ഇതിൽ സംശയങ്ങളുണ്ടെങ്കിൽ നമ്മളെ വിളിക്കാവുന്നതാണ്. ബ്രസ്റ്റ് ക്യാൻസറിനെ കുറിച്ചുള്ള എല്ലാ ഡൗട്ട്സും ഇപ്പോൾ ഡോക്ടറെ ക്ലിയർ ചെയ്യുന്നതാണ്. ഡോക്ടർ, ആൻഡ് ടോക്കിംഗ് അബൌട്ട് ദി ട്രീറ്റ്മെന്റ്സ്, വെൻ യു ആർ ടോക്കിംഗ് അബൌട്ട് ദ സർജറീസ് ആൻഡ് ഓൾ, വെൻ യു ഡു ദ സർജറി, ആഫ്റ്റർ ദാറ്റ് ഐ ഹാവ് ഹേർഡ് ദാറ്റ് വി ഡു സം കൈൻഡ് ഓഫ് ആർട്ടിഫിഷ്യൽ ബ്രസ്റ്റ്സ്, something like that we have heard. How is it about that?
You see, if it is complete breast is removed, then of course it matters to a lady that her the look is different, you know. So for that, what they do is they put up implant, which can be silicone implant, or now natural flaps also are there. But the easiest way is the implants which are put under the major muscle. So the look remains the same. So of course, yes, immediately at the same sitting, most probably, depending on from case to case, the implants are put.
And once if we remove one breast, is there any chance like, you know, it will come back or anything is there like that?
Yes. Chances of recurrence are there. But like I told you, earlier diagnosis and recurrence chances are also less. Complete cure chances in stage 1 disease is about 95%. So recurrence rate is less in stage 1. It increases as the stages go up.
Since you talked about stages, I was about to ask, like we always hear it is stage 1, stage 2, stage 3. How do we categorize that?
See, stage 1, really speaking, it's a big TNM classification. So I will make it a smaller thing, the classification. See, it is tumor, node and metastasis. So tumor is the size of the lump or size of the lesion, what we can say. So size less than 2 centimeters, stage 1. T1 we say, not stage 1. That calculation I'm not going to go in details because it is quite confusing. So we say T1 when it is less than 2 centimeters. T2 is 2 to 5 centimeters. T1 is less than 2 centimeters. T2 is 2 to 5. T3 is more than 5 and then becomes invasive. Same like in nodes. If nodes are 1 to 3, 3 to 7, 7 to 9 and 9 and above numbers. So then it becomes N1, N2, N3, N4. Then the stages come. M0 is no metastasis, M1 is metastasis. So then we mix and match all these together. And then we say stage 1, stage 2, stage 3. So I will not give T1, N1, M0 like that. There is a full table. So that is how basically the stages are formed.
Doctor, we have a caller. Hello.
Hello, hi doctor.
Hi, good afternoon.
Good afternoon. This is Mumtaz.
Okay, Mumtaz, you can talk to the doctor.
I'm 45-year-old. My mother's sister is diagnosed with breast cancer recently. She's in the 4th stage. So I just want to know whether there is a chance, hereditary chance for me, like how much, what extent is the chance like?
As I already told you, there of course in the family history of breast cancer, you are having more chance as your first degree relative, that is the mother, is suffering from breast cancer. So of course you should come for breast cancer screening, and there are higher percent of chances for you compared to the normal population. So you should get yourself screened, surely, and you are above 45. So yes, you should come for screening.
Hello?
Yes?
Hello, Mumtaz.
Yeah, I cannot hear properly.
Please reduce the TV volume and then talk.
It's already reduced.
But then we can hear some kind of disturbances.
Yeah.
Please reduce the volume and then please talk.
Okay. Yes?
Yes, as you are the daughter, first degree relative, there are chances of you getting involved more than any other common people, you know. So you should come for breast cancer screening. And of course it is required for you.
Actually, 2 years before I have done the screening.
Yes.
But there was, they said just every year, just I have to go for the mammography, that's it. Nothing problem. But last year, actually, I didn't do anything.
No, see, it is like whether you are doing self-breast examination every month.
Yeah, self-examination I used to do often.
Used to do, no, it has to be done every month regularly. And when there is a family history, every 6 months you have to get yourself examined by a trained doctor. Okay. And then let the doctor decide after every year whether you need a mammogram or any other investigation. So taking a 2 years gap between the last visit and this visit is not really advisable for you.
Okay.
So please go and see the doctor.
Okay, fine. Yeah. Thank you so much, doctor.
Okay, Mumtaz, thank you so much. Doctor, can you give some tips on how we can do the self-examination?
See, self-breast examination, we were talking and then we went into some other topic.
Yes.
So it should be done every month.
Okay.
On 5th to 7th day of the cycle. Okay. So if it is irregular, the cycle is irregular, or the lady is pregnant, or she is lactating, or she has stopped having periods, so she is already a menopausal lady, then you should select one date of every month. And you should do it on that day. It should be done in a systematic way. This is for knowing how to examine how your own breasts are felt. So you will know how it is to feel the lump. So first you'll stand in front of the mirror. It has to be done in the sleeping, like lying down position, and in the standing position, both position. You have to stand in front of the mirror and then see the both the breast size, shape, contour. See the nipple and areola, whether in the same line or is there, like I said, inversion or retraction or any flaking of skin. All those things you should see. See for the dimpling. So, or there is retraction from one skin size. So you have to do it in the 3 different positions. So you have to keep your hands above your head, on the side, and bend forward. So these are the 3 positions in which you should examine yourself. Because if you examine like that, then different kind of skin dimpling can occur. And that's how you can diagnose a lump. Then it should be done. First, this was a looking, and then look for the underarms also, whether there is any swelling in the underarms. And then you should look for, then comes the feeling. So usually it should not be done at the tip of the your hand, neither it should be done like the palm. It should be done by the pulp of your fingers. First 3 pulps of your fingers, like these 3 fingers, pulp. It should be done softly, not like very hard. And otherwise the breast is a lumpy tissue, you know, it's a fat. So everything will be felt like lump.
Yes.
So it should be done in a systematic way. Normally what people think is breast is only the round portion which they see, but it is not how we examine. It should be examined below the clavicle, or we say collarbone. So the breast starts from the collarbone, goes down. It's a rectangle. Under the arm. So it's a huge rectangle and not just the circle. So you should examine it in 3 ways. Either you start from nipple, go outwards. You can come from up down like a carpet. You clean the carpet at home like that. Or you can mark wedges. And come in different directions. But what I will tell everybody, that you make it a vertical strip, you know, because it is very difficult otherwise to go up to the collarbone.
Yes.
So we should put vertical strips from up, down completely.
Okay.
Even see under nipple and areola
Okay.
and underarms at the end.
Okay. So this is how we have to do the self-examination. And yes.
But about self-breast examination, I would like to say that first at least go to a doctor, get your clinical breast examination, let her explain to you, you know, that how do you examine the breast. Let her show you, let her take your hand, show you how you examine, because many times I have seen ladies who are doing self-breast examination, and when they come to me, they say, oh, I was doing it all wrong.
Yeah, exactly.
Okay, so I would suggest that, okay, at least once go to the doctor. When she is examining, anyway, clinical breast examination, you have to start at the age of 20. So you have to go.
Yes.
So why not to get learnt from the doctor herself that, okay, how to do examination, so you will not go wrong.
Okay.
On that, I would like to say that you have to maintain a diary.
Yeah, okay.
Okay, so last month, I found these things in my breast.
Okay.
This month, okay, I'm not finding anything. So next month, I will see again. And anytime you find that, okay, this is something abnormal, immediately go and see the doctor. Don't get worried. Don't get panicked. Don't get scared, you know, because it is very important. As I told you, early detection saves life.
Exactly.
I would like to tell you a very important thing. As I have told you already, you were scared.
Yeah.
And you said, oh my God, 2.09 million.
Yes.
But what is important is from 1989 to 2015, the death rate has gone down by 39%.
Okay. That means early detection has a role to play.
Yes, yes, that's exactly. So when you find a lump in your breast or anything, anybody who's, people come to me saying, I'm very shy, you know, I don't want to get examined. Or they say, my God, what will happen if I have the breast cancer? It is curable.
Yes.
Because if it is diagnosed early, yes, there are chances are very high, you know. If it is diagnosed as stage 1, then the chances of survival are 95.
Okay.
If it is stage 2, then it goes down, you know. Stage 4, of course, it's less than 30%.
Okay. Doctor, our time is almost up. So thank you so much. It was really informative session.
Thank you
so much for coming.
Yeah, thank you so much.
Yes. അങ്ങനെ നമ്മുടെ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റ് ഇവിടെ അവസാനിച്ചിരിക്കുകയാണ്. യെസ്, നമ്മുടെ ഇന്നത്തെ വിമൻസറുടെ സമയവും ഇവിടെ അവസാനിച്ചിരിക്കുകയാണ്. അപ്പോൾ ഒരു വീക്കെൻഡാണ് വരുന്നത്. എല്ലാ പ്രേക്ഷകർക്കും ഒരു നല്ല വീക്കെൻഡ് നേരുകയാണ്. നമുക്കറിയാം ഈ ഒരു ദിവസം എന്ന് പറയുന്നത് കേരളപ്പിറവി എന്ന് പറഞ്ഞാൽ നമ്മൾ പറഞ്ഞ പോലെ ബ്രസ്റ്റ് ക്യാൻസറിൻ്റെ കാര്യങ്ങളെല്ലാം നമ്മളൊന്ന് സംസാരിച്ചു. അപ്പോൾ ഡോക്ടർ പറയണ്ടായി സെൽഫ് എക്സാമിനേഷൻ തന്നെയാണ്, അല്ലെങ്കിൽ ഒരു ഏർലി ഡിറ്റക്ഷൻ തന്നെയാണ് ഏറ്റവും വലിയ കാര്യം എന്നുള്ളത്. നമ്മൾ ആരും പേടിച്ചിരിക്കേണ്ട ആവശ്യമില്ല. അതായത് നമുക്കിത് ഉണ്ടാവോ എന്ന് വെച്ച് നമ്മൾ ഡോക്ടറെ കാണാതെയോ പേടിച്ചിരിക്കേണ്ട യാതൊരു കാര്യങ്ങളും ഇല്ല. എത്രയും വേഗം അത് ഡിറ്റക്ട് ചെയ്ത് കഴിഞ്ഞാൽ ക്യൂറബിൾ ആണ് എന്ന് തന്നെയാണ് പറയുന്നത്. അപ്പോൾ എന്തായാലും കെയർ ആൻഡ് ക്യൂർ സെഗ്മെൻറ്റ് ഇന്ന് എല്ലാവർക്കും ഇൻഫോർമേറ്റീവ് ആയി എന്ന് തന്നെ വിചാരിക്കുന്നു. ഇതോടുകൂടി ഈ ഒരു കെയർ ആൻഡ് ക്യൂർ സെഗ്മെൻറ്റ് ഇവിടെ അവസാനിച്ചിരിക്കുകയാണ്.